One of the staples in your protocol to treat cancer is nutrition.
Correct.
Can you talk about the importance of nutrition in treating cancer? Why does it play such a big role?
Well, part of the issue with the work that we do is that as patients take the pancreatic enzymes and the enzymes work on the body, you need the body to be as strong as possible to handle that whole process because a lot of waste materials are formed. And if you're eating, in effect, a lot of things that need to be processed and gotten rid of, like pesticide residues or sprays or waxes or chemicals, those sorts of things, we think that that just puts an extra load on the body to process and deal with that kind of thing. So you need good quality food to be able to have the energy to fight the cancer and to get rid of the waste materials as the enzymes work on cancer. And certainly, I think that nutritional issues can have a big part of why people get cancer in the first place. So it doesn't make sense to think that an illness that's created by a lifestyle can be managed without modifying that lifestyle. In other words, why would you want to go back to the same lifestyle that got you to where you didn't want to be? You need to make some changes, and diet has a big part to do with it.
I love the quote about why would you want to go back to that lifestyle? If you've got a disease that's caused by these lifestyle issues, don't go back to where you came from. It reminds me of a recent communication that I had from a cancer patient that had changed the diet, had done all these things, and then went back and ended up, this was an email from a relative that the cancer patient had died. And it's really sad to see that they had successfully reverted the cancer, cured the cancer, whatever you want to call it. The cancer, they were not being affected in a negative way from the cancer. And then they went back to their old eating habits, went back to their old lifestyle habits, and the cancer came back. And that is a common thread that I've seen over my years of research. I'm guessing that's a common thread that you've seen as well.
Unfortunately, yes, but as much as I can, I try to focus on the patients that do follow through, because that's how you can see what's possible. All I can do is give people the tools. They have to choose to pick them up and keep using them.
Kind of like the difference in biblically speaking, between knowledge and wisdom. Knowledge is knowing it, but not necessarily applying it. Wisdom is when you apply it.
Right.
So we want to be wise with this knowledge that we're obtaining on cancer and apply it to our lives.
Exactly.
Yeah.